Hi, I'm Assistant Professor Myriam Shaw Ojeda from The Ohio State University College of Pharmacy, and this is my Q&A. Okay. Who are you? Well, first and foremost, I am a pharmacist by training and a professor, and my passion lies in the area of public health. When I'm not at work, I do love to go to farmers markets and cook up a storm with friends. I have a few curry recipes that are a hit. And however, when I'm at work, I really like to discover the disparities that our Ohio populations face and then connect local pharmacists to those disparities to bring solutions. Perfect. All right, our question is, what does public health mean to you? So a lot of us working in pharmacy look at patients as one-on-one individuals, but public health is really more population-wide. So we're looking at birth rates, death rates, disease rates, and trying to find solutions to that. Now in my world, currently in this era of my public health service, it's more looking into rural populations and figuring out what kind of disparities in accessing healthcare do these people have, and how do we engage with pharmacists and student pharmacists to make solutions happen. Why is the role of pharmacists so powerful for information dispersal? There are two pillars for why this actually makes sense for a pharmacist to be that information giver to their community. Number one, and this is no surprise to most of us, pharmacists are accessible. A lot of you are members of your community, both in an informal manner, you live in those communities, but in a formal manner, you work in those communities. And oftentimes, because of that accessibility, we get to see patients far more often than other healthcare providers. The second piece of this is also that we're trusted. We're healthcare providers that are there for our patients, and our patients know that. And so when they look for trusted sources of information, oftentimes they're coming to you for their answers. Okay, the question is, where can one find the gap that they are meant to fill? Well, oftentimes the gaps that I find that I'm meant to fill come to me by accident. But that's because I'm involved in finding opportunities where these happy accidents occur. Two of the areas right now that I'm working in is in vaccine hesitancy. So trying to explore ways that we can reach out to our rural communities and educate them on vaccines in a way that makes sense for them. And also in the nicotine cessation space, and figuring out a way to create educational resources and equip pharmacists to help their patients stop smoking and stop using nicotine products. For you as a local pharmacist, if you're working in your community, I would encourage you to get involved with your community. Are you involved in your school board? Are you involved in a local library event? Are you taking part in community events where you are more exposed to the population that you live with, work with, play with? And those instances can give you hints at potential opportunities for public health work, whether that's through naloxone training in the school system, smoking cessation work within your community. Our most informed pharmacists are those who are also informed members of their community. I'm just surprised I'm not missing these. Okay, the next question. What does maintenance for community health programs look like? This is a great question, first of all. I believe that public health projects usually are just as effective as the funding that backs them. And I hate to say it that way because oftentimes that is how public health works. You get funding for a certain project, procedure, and you move forward until the funding runs out. But that's not sustainable for the communities that we're serving, and that's certainly not sustainable for the profession of pharmacy. We are long-standing members of our community that have served our community for generations. And so within public health, when I talk to my pharmacist colleagues about public health efforts, I want to encourage you all to not only consider what's shiny and new and what's the innovative project that you want to work towards, but also how do we make these projects sustainable? Here are the two things that I would recommend to keep a project going into maintenance mode. The first is, how are you training the trainers in the community to make sure that that project remains sustainable? Remember, these are people who are living long-term in the communities of target. And then secondly, how are you making sure that the funding resources, educational resources, and more, any sort of resource that you're using is sustainable for today and into the future to make sure your project lasts. So this question is, why are academics important in advancing public health? I love this question because, of course, as a biased professor myself, I do believe there's an importance for academics in the world of public health. Firstly, academics bring in resourcing through data analysis, our ability to look for areas where there are gaps because we have researchers working with us. And then on that side, aside from keeping those ducks in a row, we also are interested in publishing the work that we do. And the reason for that is not necessarily for the clout that it brings or the publicity that it brings to a project, but really making sure that the work is replicable. So my hope is the work I'm doing here in Ohio in rural populations, that it gets replicated to our neighbors and other individuals, not only in Ohio, but beyond, that work with rural populations. And so sometimes having the manuscripts, the submissions to journals, those news articles, even interviews like this one, help to promote the work that our pharmacists are doing. And sometimes, frankly speaking, don't have the time to sit down and write a 10-page paper on. Call me. I'm willing to help. Call other academics in your community. We're all willing to help in this space. All done. I'm going to leave you with some final thoughts. I encourage you to be courageous. Go and find those disparities in your communities and take that first step. You never know where it will lead, and more importantly, you never know the people whose lives you will impact by taking that first step. Thanks for listening.